Well, hello there. It's so great to be back this week. How are you all doing? All right, we actually just got back from the Bahamas. I was at the Women Physician Wellness Conference with Dr. Erica Howe. If you have not been to a Women Physician Wellness Conference, I highly recommend that you attend. Okay, so I consider myself the godmother of WPW. I love, love, love her mission. And she has 4 conferences a year. So Bahamas, and this conference is a women professional conference. So physicians, non-physicians, fantastic, great, dynamic group. And then we do Grand Cayman. Okay, that's coming up in February. In May, we go to Aruba. And then in October, we go to Amelia Island in Florida. Okay, so I just highly recommend it. We had the best time. Mark came with me. We brought our girls. And they met up with Dr. Christy Angevine, her daughter Rosalind, and they spent all the time together. We had Dr. Linda Street there. She had her boys there. It was really, really fun. Actually, Mazzy, okay, so Mazzy, who we all know and love, she's my chief of operations. She attended along with her best friend Lynn. So that was super cool. So we had a great time. I spoke on energy preservation, okay, which was awesome. So how to preserve your energy for personal growth, essentially. And I led 3 different workouts, and I also did a nutrition training workshop, which is what we're talking about today, my friends. All right, so I am so excited to dive into today's episode. Today we're going to be talking about the gap in nutrition training as doctors. Okay, it is a big issue. All right, now there's a big reason why I wanted to create this episode. There's some things I want to put out there. I just want to get them off my chest, put them out there. The social media that is out there, right? So many posts just bashing doctors for not doing anything preventative, not knowing any of the lifestyle parameters, not teaching patients about nutrition and not, guiding them on exercise. And it's gotten pretty darn bad. In fact, today, I won't mention the creator's account, but it's not how I roll, but I was on Instagram and there was a creator who did this skit and she was acting as both characters. So she was a doctor on one side and then she was the patient on the other. And she went in and she was obviously having a discussion with her doctor on weight loss. And the doctor says, "Oh, well, I'm just going to give you a script for Ozempic." And her as the patient says, "Well, aren't there other things I can do like exercise and nutrition?" And then when she became the doctor character, she says, "Yeah, but nobody does that anyway, so we don't do that. So I'm just going to give you a script." Okay, so it was just really bashing the way that potentially doctors are perceived. And here's the reality. Let me give you the reality right here. Okay. I had 0 hours of nutrition training in medical school. Okay, they say if you look up the research, they'll say 1 to 25 hours. There's not even like a consensus on how much is actually happening. I don't know that there's any institution that's doing 25 hours of nutrition training. Okay, so when I was in medical school, we had 0 hours of nutrition training, and I'm not kidding, right? You would learn about the diabetic diet. Well, the thing that was interesting to me is that we would be rounding when I was a medical student, and it would be internal medicine rounds, and we had, an individual who has diabetes and was there for, came out of the ICU, had, was in DKA, came out of the ICU, was on the floor, and so we were managing the patient, and breakfast arrives. And part of the treatment protocol on the orders was diabetic diet. Okay, I am sorry, but since when has cereal with skim milk, white toast with butter, a banana, an orange, and a yogurt? Like, how is that a diabetic diet? I'm very confused. I don't understand, in fact. Okay, so I'm just saying that there's a gap, and I'm going to talk about that gap today, okay? But I'm here because I'm a doctor, and I'm going to back us up for a minute, okay? We were not trained. First of all, most of us that went to medical school didn't say, "Oh, I'm going to go to medical school to become an expert in nutrition," right? And the problem with medical training is that, first of all, nutrition is medicine, right? It is. So nutrition is important to help heal chronic disease, yes. It is absolutely a mainstay player in preventative health, for sure, okay? It's literally the second best tool now, because it used to be the number one tool until the GLP-1s came. It's the best tool for weight loss that will then decrease hypertension, diabetes, sleep apnea, hypertension. You see where I'm going with this? So while nutrition needs to be in medical education, and it is, in fact, Harvard, I believe, they are going to be the first group that is instituting it. So it is coming, my friends, okay? And I'm really proud of the community because it's happening. And there are many of us, doctors, who practice in a way where nutrition is the first strategy. Now, it's not going to be the majority of us, but there are some of us. Now, if you look at it though, okay, I'm going to back all of us doctors up again. Who are the doctors that are doing primarily nutrition work with their patients, clients, depending on the practice model? Okay, that's their full-time job if they're doing that. That is my full-time job. That is what I do full-time. I full-time manage nutrition and exercise. Okay, so if a doctor is managing medications, okay, acute symptoms, emergencies, all of the other things, okay, and again, having a very short time in a patient visit to actually even address those things, how are they supposed to counsel their patients on nutrition? Okay, so I'm gonna go one step further now. When I first put out my nutrition training program, okay, because this is going somewhere, right? Because my career is nutrition, but that's what I do full time. I'm not managing anything else. I'm managing nutrition, I'm managing exercise, I'm managing mindset work, I'm managing emotional regulation. That is a full-time job, okay? Now, I'm blessed. Most of my clients have been doctors, okay? They take the learnings, the teachings from me, and they bring it to their patients, okay? However, they all say the same thing. How do they actually go ahead and give it to their patients and allow their patients to benefit from it, right, with the amount of time they currently have? And the answer is that is still something that, needs to be figured out for sure. I do foresee that there's going to be more and more doctors that their primary practice is going to be nutrition, exercise, mindset work. I love obesity medicine for that reason. The 4 pillars of obesity medicine are nutrition, exercise, okay? CBT, which is thought work, mindset work, and medication. Beautiful, right? However, if you are working in an academic center as an obesity medicine doc and you have a wait list that's 12 months long, I don't know how much time you have to do all those things. Now, you're going to say to me, why don't you consult a dietitian? Why don't you consult a nutritionist? In fact, when I put my training program out, my nutrition training program, this is interesting. I put it out there, and basically I was saying for the past 8 years, I have practiced modern medicine. So one of my clients kind of shared with me, she sees me as her doctor. And she says it's because she believes that I'm a modern doctor. Okay, so my practice is preventative care because I work in a coaching capacity so that I can serve more people across state lines, but I'm not prescribing medication because otherwise I wouldn't be able to work with as many people across state lines, right? And so, right, my focus is completely all the lifestyle tools, okay? And I want to say once again, and that is all I do, okay? So I think it's unrealistic for the way current medicine is set up unless you have a very, high-level concierge practice or, a private practice that, allots for, the time for this. Or even if insurance companies reimburse for this. I mean, a lot of times, that's not happening, right? We can't expect that that's all going to happen in a 15-minute visit, okay? So there's a lot of barriers here. But here's the thing. when I did put out the nutrition training, I had a lot of nutritionists and registered dietitians who I think felt offended. And they would say things like, or you could just consult a nutritionist or dietitian. And that's great. And we do a lot. In fact, that happens all the time. So many practices have nutritionists and dietitians, and that's amazing. Okay, this is what I want to put out there though. If doctors don't know anything about nutrition and we are relying on a nutritionist or dietitian, okay, to come in and take care of all of that, that means we don't even know how to communicate with the nutritionist and dietitian on what to do next, right? Like the conversation isn't going to be as robust if we don't know what we're talking about. So yes, I agree with dietitians and registered dietitians and nutritionists. And I think that's the same thing, registered dietitians and dietitians. Well, I mean, if you're not registered and you're a dietitian, fine, whatever. I'm covering my bases here. Okay. Like we want to have the conversation. So it's silly to hold back training doctors on nutrition when, number one, our patients actually expect that we are experts. They expect that of us. Sorry. They expect that we are experts with exercise, you know. They expect that we are experts with sleep management. And here's the thing, behind the scenes as doctors ourselves, often we're struggling, right? Because yes, it takes a team, but we all have the right to be educated on nutrition. Okay, so what I could tell and the sense that I got was that some of the people who commented on my program, nothing mean, right? But it was like, oh, you should just consult a nutritionist. Okay, my dad is a rural doctor. He does not have access to a dietitian or nutritionist. Okay, my dad actually, when I was 18 and I was interested in nutrition and I was learning and self-learning and all those things, I counseled patients in his practice on nutrition. It's interesting that, you know, here I am years later and that's what I do now. I didn't actually foresee that coming, but I found a way to do it. And what I'll say is this. My focus of nutrition first came from having, I was an overweight kid. You know that. I talk about it a lot because it was an important part of my life. And I became obsessed with diet books and I became obsessed with the science of weight loss. And I became obsessed with the science of exercise. And it was not good at first. It was an obsession. And I did something really good with it. Okay, so I created it in a way. Well, first I healed myself, okay, which is amazing that I was able to do it at the age I did. And again, I'm not saying, oh, I'm healed. I mean, I am always working on things, believe me, right? What I'll say, though, is it was a blessing that I had exposure to all of that because I learned how to become strategic with exercise as it relates to overcoming mindset obstacles, things like being an all or none person or, you know, all the different thought distortions that happen, really understanding personally what significant emotional eating feels like, okay? And being able to then learn tools to help myself and then help other people, okay? All of these things. So I think the point is that, you know, nutritionists, dietitians should not be threatened by the fact that we want education too. It's going to help the patient the most. So if you have a dietitian and nutritionist on the team, excellent. So if you have one team with a doctor who understands nutrition, and let's put it this way, there's all different ways we can approach nutrition. My focus, my niche is nutrition for metabolic health, okay? Which often then involves fat loss, which often then involves muscle gain, okay? So my strategy and expertise comes with metabolic health. Okay, so if you want to know how to get the most B vitamins, a registered dietitian is going to be way better at that than me. Okay, I'm just going to say take a multivitamin. But and there's some, right, obviously registered dietitians and nutritionists who deal specifically with metabolic health for sure. Okay, my area where I focus on is metabolic health. And not only that, but it's how you incorporate that nutrition strategy with a strategic exercise strategy so that we are making sure that we're maintaining muscle mass. Because I have to be honest, metabolic health has a lot to do with your muscle mass, a lot. Okay, so my point is team one has a nutritionist, dietitian, whole team, several of them, and a doctor who doesn't understand anything about metabolic health and nutrition, how they're related. And then you have another team, okay, nutritionists, dietitians, there's several of them, and you have a doctor who gets it. They took a program. They did have to seek out their own program. That's one of the obstacles, because right now, if you want nutrition training as a doctor, you do have to seek out your own stuff. Okay, and I will talk a little bit about my program. This is exactly why I created my CME program. In fact, one of the things as I was doing my research, they said, is there's a barrier with continuing education in that there's not a lot of programs that have nutrition training that are CME. Okay, now I will tell you, I mean, I've taken ones that are. So there's a couple that I took when I was training for my obesity medicine boards. But none of them, I have to tell you, they were robust and wonderful and great, and I got things out of them, yes. I needed CME through that. But the reality is that I didn't learn anything from there that would help me feel really confident being a metabolic health strategist. Okay, and that's how I define myself now, right? To me, that feels authentic. Okay, so if you took those two teams, what team do you think would be stronger in basically delivering better patient care? It's going to be the team that can have the conversation about the nutrition. That's going to be the doctor who's trained in nutrition, as well as the nutritionist and the dietitian team. I say both because I'm just thinking that I'm pretending there's a big team. There's a whole big team of nutritionists and dietitians. Maybe the same thing, but maybe not. I'm defining both because, again, maybe different pathways. Okay, so let me tell you what happened. So I've been obviously working as a modern doctor now for 8 years. Exercise is my jam, nutrition is my jam. All the lifestyle things that they say doctors know nothing about, that is what I do. Okay, so for me, I see those things and I'm like, people, right? And then I'm also backing my friends up because I'm like, yeah, and you see my friend over there who has 50 patients scheduled on this one day? Yeah, they're not gonna have time to talk about nutrition, okay, necessarily. All right, now there's lots of ways that people are making changes to bring more of this nutrition strategy into their practices, okay? And there's some amazing doctors out there that work right alongside with me that are doing really, really amazing things. But most of them do have direct primary care where they own the practice or they're a partner or they have a concierge primary care practice or obesity medicine practice. So my point is, if you want to have that type of practice, then you probably have to be the one in control of it to make these things happen. Okay, so here was what happened. I put out my advertisement on my nutrition training program. And I was all excited about it, right? Because I have a 48 CME credit nutrition training program that was created for doctors. Also healthcare professionals, right? So it can be anybody working in healthcare with patients. I'm really proud of it. The program's awesome, okay? It is 24 different topics. I go through everything. So when you take the program, right, you will come out an expert. You will be an expert in metabolic management of your patients. I'm going to stick by that, right? Now, when I said the word expert, it did offend some of the registered dietitians. They were very nice about it. And so because I want to respect them, I looked into becoming a registered dietitian because I said, listen, I have this training program. It's amazing. I mean, I am an obesity medicine doctor. I strategize nutrition and exercise for metabolic health. Okay, so my program I'm sorry, it's awesome. I love it. It's great. It will help so many people. Our first round, we had 200 healthcare providers take it. 200. So we have 200 people that have been trained. That's incredible. So my impact is different. Okay, and the way that I set it up is that I created guides for them that they could actually hand out to their patients, okay? So this way, even if they have a 15-minute visit, they could at least help their patient get started with one thing, okay? And, my nutrition strategies are pretty safe. They're simple, they're basic, they're straightforward. There's not many patients that are gonna be following strict macros, Okay, so it can be intuitive eating. I know I have a couple of guidelines for intuitive eating. Intuitive eating is supposed to be that like whatever your body says it wants, you feed it. Okay, it's very compassionate. However, if you eat a whole bunch of sugar, your body's going to keep telling you that you want more sugar. If you eat plenty of protein and limit your added sugar, your body's going to tell you what it actually needs and can use. So intuitive eating for me, I have a couple of rules with it. So I don't know if I could call it strict intuitive eating because I have a couple of rules. And with intuitive eating, you typically don't have rules. Then I have my custom trademark program, Mindful Macros, that I teach right in my nutrition training. This is the most popular one because it emphasizes metabolic health without having to weigh or measure or meal prep your food, okay? It's awesome. I just came out with a recipe guide. It's called 365 Days of Lunches. That guide is like 300 pages. And basically it has lunch, making one protein, 7 lunches. So you make one protein a week, 7 lunches, and you do that all year. Okay, so this is to help people really go ahead and help themselves, but also help their patients in realistic ways. Okay, so with all that being said, I looked into becoming a dietitian. I have a lot of ramblings today because this is loaded. And I looked into it and I actually reached out to programs because I said, okay, I'm a physician. I've already taken all these prerequisites. Like, what would I have to do? And the only reason I would do it, I don't feel like I need the training. And I don't mean that in a, I don't mean that in a way that I know everything. I just mean when I looked at the training curriculum, what I would have been required to take were things like health policy, okay, nutrition in the community, okay. I don't know, and so I reached out to my personal friends who are dietitians. I said, listen, do you think I should become an RD? And they said, absolutely not. They said, absolutely not. And the reality is I just have to be okay with people being wrong about me, okay? Because I am teaching nutrition for metabolic health, which is what doctors need. Doctors need that, right? Because if we can prevent metabolic disease, if we can reverse metabolic disease, guess what we just did? We just saved ourselves from a whole lot of chronic disease. And that's why I love being in obesity medicine, right? Because if we can reverse metabolic disease, okay, we are going to be sitting pretty. And it's going to take a long time. And we need a lot of people on board, a lot of people. And so kind of the scarcity when I felt that I was being looked down upon by, let's just say, somebody who is a registered dietitian, the more the merrier. Like the more people that understand it, the more doctors, the more healthcare professionals, nurse practitioners, PAs, nurses, respiratory therapists, the whole shebang, right? The more of us that can be confident in this, the better we are going to be together. Like this is not a scarcity thing. To me, this is abundant. So I love my dietitians. I love them, okay? I love the nutritionists that I've had the pleasure of working with, okay? And doctors need to be educated. Doctors do need to be experts. If they are not experts, they can't communicate with their team and they can't communicate with the patient. And our patients expect that we are the expert, okay? There's an easy way around this. There really is, okay? Learning nutrition for metabolic health is what I think every doctor needs. All right, and I told you, I created it in 24 modules, and that includes pediatric stuff, okay? 24 modules, okay? I'm talking hours where you can get the concepts, like really understanding kind of the hormone imbalances, understanding, how you approach somebody, how you proceed with motivational interviewing, how you really assess for readiness. Because one of the things that happens is we start blaming ourselves for our patients and clients not getting results, and that's not the reality. Teaching how to do a really sound nutrition audit, okay? Teaching about all the different styles of nutrition in terms of how do you balance it in a way that you're giving macros that are going to help metabolic health. Not the diabetic diet I saw in the hospital with toast and cereal and sugary yogurt and orange juice. That's what it was. It was orange juice. I was falling over. I couldn't believe it, okay? So my point is, in the future, coming soon, there is going to be a requirement for doctors to take so many nutrition hours. That is coming. Okay, so I'm just putting it out there that those of us who are done with medical training, we got to find our own way to figure it out. Okay, and that is why I created my program, because of the huge gap. I created my program to fill a gap. I want healthcare professionals to be experts in nutrition. And listen, if that offends somebody, I'm sorry, but I'm not sorry. Because if my doctor took the extra step, which she has, she's taken my program, but if I knew that my provider, and I know a lot of people don't like the word provider, but if my doctor went ahead and took the extra step to learn from another doctor who all they do is nutrition for metabolic health, I would feel pretty damn taken care of. Pretty damn taken care of. Okay? So I put this program together, and the really cool thing is that I have a continual monthly Q&A in it. And you know what? It's awesome because a lot of the questions now the doctors are asking, and we have nurse practitioners, we have PAs, we have some nurses in there. They're asking the questions that are actually, I think, more personal questions now. They're asking about their own nutrition, right? Which tells me that they are putting the things into action, which means their patients are going to be better off, right? See one, teach one, do one, okay? That's what we're doing with nutrition, all right? So education in medical school is coming. It is. They've already said it. I believe it's Harvard. They already said it. It's coming. It's happening. They're creating it. Okay. So for other specialties to say, well, just go consult, your registered dietitian or your nutritionist team, or just go do that. That's not, we can't just do that. We will do that, but we can't just do that. We have to be experts too. That is the only way we are going to be able to communicate with our registered dietitians and everybody on our nutrition team. We have to, think about it this way. When you have a conversation with somebody and they know what you're talking about, doesn't it go a lot easier than when you have a conversation with somebody who has no idea what you're talking about? That's what I'm talking about, okay? All right. So other things, as I mentioned, not all nutrition trainings are going to be quality controlled. I am sure there's other nutrition trainings out there. However, I will say that when I created mine, it was specifically to teach doctors how to become experts in managing their patients for the best metabolic health. So I want the doctors to have their most optimal metabolic health. I want their patients to have the most optimal metabolic health. I have a lot of physician coaches that are taking the program because they coach a lot, right, in their programs. And one of the things they always say is, I don't have any nutrition background. So if I get a client who's coming to me working one-on-one and they want weight loss, I don't feel comfortable. And how I feel about that is, listen, there's a lot of things to coach on for weight loss that has nothing to do with food. All right? The reality is, what you can share with them by simply taking my training program is going to be enough. Because you're going to be coaching on all the emotional stuff, all right? And then, you're going to have the ability to be able to advise them based on my work. This is work that I've been doing for years, right? In the past, it's longer than 8 years, but in the past 8 years, it's become a business, okay? And then this was the next step. And I have so much energy around this nutrition training. Okay, so other things to just mention. Okay, so gaps, we didn't get the training, and then we don't have the time, and then not all programs are potentially going to be good enough. What do we do? And then, there's so many other things we could put in there. Okay, so I do believe that, modern medicine, it has to lean more towards preventative care. And if you think about it this way, it's kind of one of the best shots we got, right? Because everything's so uncertain. Insurance, what insurance is going to cover? Uncertain, right? If you can be on a certain medication, uncertain. If you can even get the medication, uncertain. All these things. So the thing that we can actually be empowered with, okay, is this preventative health piece, which is optimizing metabolic health, okay? So I'm here to say that no, we did not get training in medical school. Training is now available in my 48 CME nutrition training program, okay? There's other programs, I am sure. I will tell you mine focuses on metabolic health and having the doctor become an expert in guiding your patients. Most likely, if you're guiding your patients on nutrition, it's going to be, it can be several things, right? Because if you are hemonc or if you're radiation oncology, which I do have clients like that, there might be some other nuances, but here's what I want to tell you. I have a client who got diagnosed with breast cancer and had a mastectomy, chemo, and radiation. And she worked with me all last year, followed all my nutrition strategy, became an expert in my nutrition training, took my nutrition training program, and she gained 2 pounds of muscle during her cancer treatment. That's unheard of. Like, that's incredible. She did it. Okay, during treatment is my point. Okay. That's incredible. That's remarkable. She's now one of my head nutrition coaches in my program. Talk about that. I just got chills. That's incredible. Like, hello. She's the expert. She's literally the person in my program that I'm like, okay. And by the way, I'm talking like this because she has a testimonial like out there and she is totally open to me talking about this. But what I want to say is she's the person right now that she's my go-to, right? Because she went through her own journey, a complicated journey. She became an expert, okay? And now, here she is, an expert in nutrition, helping right now. We have a couple hundred people, like she's helping right now, okay? Incredible. So I'm telling you, the power of the training works. Okay, so if you are feeling like you want to understand nutrition in a way that is kind of just obvious, it's easy, it's doable, okay? It's not hard to learn. After making so much content for so many years, I pretty much get to the point. Check out my nutrition training program. We currently have the wait list open. We're about to open enrollment, okay? It's an incredible program. You do it at your own pace, okay? And then we have some live calls. We have a monthly live call where I answer your questions. Okay, so you get to also ask me questions. So you have a little a discussion thread where you can pop all those questions in there. I answer them monthly with a live call. It's an amazing group and would love for you to check it out. And again, we are waitlist transitioning to enrollment very soon. We're about to announce the date, but it's coming. And so I just want to let you know that we got you, right? We got you. We see you. And there's nothing that's gone wrong. If I were out there, if I never had a weight problem as a kid and I was out there practicing traditional medicine, I would not know anything about this because my pain turned into my passion. So I became very interested in this, right? And now this is all I do. Okay, so I don't expect that most people would know this. I don't expect that. Okay, so I got your back. That's all I'm saying. So check it out. We're going to link Nutrition Training Program 48 CMEs. Okay, so it's CME. Use your CME money. Okay, it's awesome. I'm going to link it in this episode. And, as I mentioned, all the love. But I think, yes, we have our experts. Okay, and we need to be experts. Our patients expect us to be experts. And imagine the change we can make with obesity in our country, with chronic disease in our country, by more of us becoming experts, okay? This is not about scarcity anymore. This is about everybody being an expert, okay? And that's why in my program, I have all the content, I created it, and, I say, listen, yes, it's the Fit Collective, and I would love for you to share it with your patients and your clients and your people. So here we are. I'm passionate about this. I'm really excited to keep chatting on nutrition. Okay, so I got some really good episodes coming up. I hope you have a great week. Share this episode with somebody who you think it would benefit. And until next time, friends, we'll talk to you soon.